Hi, my name is Dawn Isherwood. I'm with the Department of Simulation at Fort Belvoir, and we were tasked with an unusual training for the physicians in the emergency room for jet ventilation. They wanted to practice that. It is something they don't see very often. Generally in children, you see it after anesthesia, but if the child comes in and is unable to be ventilated and unable to be intubated, then rather than immediately going to a crike, the jet ventilation allows them to get air to the child in a rapid fashion. At Fort Belvoir, we have one official jet ventilation system. It belongs to ENT, and it's kept up in the OR. So after hours and even during the day, it doesn't have, the ED does not have complete access to this equipment. So Dr. Sangiorgi had given me a list of equipment that she wanted to use kind of as a makeshift and practice with this. So what I have is a 3 cc syringe, oxygen tubing. I have the tip off of a 6 millimeter ET tube, a 16 gauge syringe, and a Ambu Bag. So as they do this, the 16 gauge needle will go in. They'll bring it back out, and they'll have somebody hold and place that. Inside of the 3 cc syringe comes out, and the tip of the ET tube goes in, nice and secure. We go ahead and attach while it's still being held. Hook up our oxygen. Okay, and then the Ambu Bag can be placed on, and oxygen can be delivered to the child. So as we were looking at this, our team, we thought, okay, that's kind of cumbersome. You're dependent on the volume of whoever is bagging the child to do this. So we took a look around to see the equipment that we had here. Dr. Sangiorgi had given me several YouTube videos to watch and how other emergency rooms had done this. And so we put a kit together, and this kit includes the tubing, the same tubing. It includes a high flow ventilation with a 3-way stopcock. And this is actually a child or a neonate suction tubing. So what I did was I took the center off of the suction tubing, and I took my high flow tubing can now connect to our 16 gauge and be secure there. On the other side, now much like the jet ventilation that we have upstairs, we now have a valve that allows us to control the pressure flow that goes in. And this actually fits very snugly right into our tubing. Okay, so now with this being held, we can use this as an on-off valve to put oxygen in, inspiration, expiration, and they're able to control. This tubing then allows actually the physician to step away from the patient a little bit more. They can see the chest rise and fall, and they don't have to worry about the weight of the Ambu Bag coming down and possibly bending the 16 gauge catheter that is in there. This was tested today by the emergency room and trauma surgeon. It worked well for them, and so we will see about in further training how they will use this adaptation of our jet flow ventilator.